We are going to begin our discussion on the musculoskeletal system, and today I've just come to introduce it. Now, under the musculoskeletal system, we are going to be looking at the skeletal muscles of the body. The skeletal muscles. Skeletal muscles, we're talking about muscles which have attachment to bone. But you must notice that some of the skeletal muscles, we have talked about them. So I'm not going to teach them under this course because they have already been covered. We have talked about the intercostal muscles, they are skeletal muscles. We have also talked about the muscles of the anterior abdominal wall and then the muscles of the pelvis. Remember when we were looking at the digestive system, we talked about the abdominal wall, we looked at those muscles. And when we are looking at the cardiorespiratory system, we talked about the thoracic wall and we talked about the intercostal muscles. So those ones, I'm not going to teach them, but they will be examined because they are under the musculoskeletal system. The muscles we are going to look at are going to be muscles of the upper limb and muscles of the lower limb. We are going to look at those ones, muscles of the upper limb and muscles of the lower limb. And we are also going to look at the skeleton or the skeletal system of the upper limb and the skeletal system of the lower limb. The skeletal system of the thoracic wall, we looked at it last semester, the thoracic cage, the bony component. That one we are not going to look at it again, but it will be examined. So here we are going to concentrate on the skeletal system or the bones which make up the upper limb and their joints, and the bones which make up the lower limb and their joints. And you're also going to look at the muscles which make up their upper limb and the muscles which make up the lower limb. Under muscles, we are going to be looking at the origin and insertion of the muscle. Muscles have attachments, two major attachments. We have what we call the origin of a muscle and then the insertion of the muscle. The origin of the muscle, that is the part of the bone where the muscle is attached, from where it bases to perform an action which is going to give rise to a movement. For example, the part of the bone where the muscle inserts, that is the part which is going to be moved. So when we say that a muscle, for example, like coracobrachialis, originates from the coracoid process and inserts on the humerus, it means that the humerus is the one which is going to move. So the two attachments of muscles, we are going to be talking about the origin and the insertion for both muscles of the upper limb and muscles of the lower limb. On top of that, we are going to talk about the nerve supply of every muscle and the action that muscle performs. For example, when that muscle contracts, which movement does it perform? Basically, that's what you're going to be doing. Now, the muscles of the head and neck and the face, those ones which shall guide you at the end of the lower limb on how you're going to read the muscles of the neck and the head. Now, we are going to begin with the upper limb. The different parts of the upper limb have the shoulder, the arm, the forearm, and the hand. The shoulder has different regions. The shoulder has what we call the pectoral region, which is the region of the breast. The pectoral region is the region of the breast, and this pectoral region has muscles. We are going to look at the muscle known as pectoralis major, pectoralis minor, subclavius, and serratus anterior. They are the muscles which are located in the pectoral region where the breast is sitting. The shoulder also has what we call the scapular region. The scapular region is the region of the shoulder which contains that bone known as the scapula. So whenever we talk about the scapular region, we're talking about the region of the bone known as the scapula, and then the muscles attached to it. The arm is between the shoulder joint and the elbow joint. And we are also going to talk about the muscles of the arm. And if we are to do the muscles of the arm, we shall also look at the anatomy of that bone of the arm known as the humerus. So the arm is between the shoulder joint and the elbow joint. After the arm, we are going to go and look at the muscles of the forearm. The forearm is between the elbow joint and the wrist joint. And finally, we are going to go and look at the muscles of the hand, and we see how many they are. So these are the parts of the upper limb: the shoulder, the arm, the forearm, and the hand. And we are going to be looking at muscles in each of these regions, and the nerves and the blood vessels. Now, after doing the upper limb, that is when we shall proceed to the lower limb. It also has its muscles. They have a nerve supply, they have origins and insertions, and they have a blood supply. So it's going to be quite a lot, and we must be vigilant and hardworking. The textbooks I gave you last semester are the same textbooks that apply to this course. So whenever we are talking about the upper limb, the first thing we talk about is what we call the brachial plexus. The brachial plexus. Brachial comes from the word brachium, representing the arm, which means the arm. Plexus means a network. So whenever they're talking about brachial plexus, they talk about a network of the arm, brachial arm network plexus. What is this network? This is a network of nerves. When you look at our anatomical images, the nerves are usually colored yellow. So you can see here, between the neck and the shoulder, there is a network of nerves which are coming from the spinal cord, which is contained within the vertebral column. They come from the spinal cord, these nerves, and then they pass through the base of the neck and the armpit, which is the axilla, and then these nerves proceed down to the upper limb to supply it. So this network of nerves at the root of the neck and the axilla is what we call the brachial plexus. The muscles of the upper limb are supplied by these nerves, the nerves of the brachial plexus. We are going to be talking about the different muscles of the upper limb and the nerve supply of those muscles. And if you have understood the brachial plexus, you will also understand the nerve supply of the different muscles, because the nerves which supply the different muscles come from the brachial plexus. That is why it is very important for us to first study the brachial plexus before we proceed to look at the muscles of the upper limb. So this is what we call the brachial plexus. A network of nerves at the root of the neck and the armpit, which is the axilla. This is what we call the brachial plexus. And the nerves which are going to supply the muscles of the upper limb are going to branch off from the brachial plexus to supply those muscles. Now, this is the vertebral column, and on the inside of the vertebral column, there is a spinal cord, which is a component of the central nervous system. So the spinal cord gives off nerves. These are nerves branching off from the spinal cord. So the nerves which are branching off from the spinal cord are known as spinal nerves. Whenever you hear the word spinal nerves, they are referring to the nerves which are branching off from the spinal cord, or the nerves which are connected to the spinal cord. They are known as spinal nerves. When the spinal cord is passing through the neck, it gives off 8 spinal nerves. 8 pairs, because it's both on the right and on the left. So when the spinal cord is passing through the neck, it gives off 8 pairs of spinal nerves. And when we come into the neck, we use the word cervical, C. Because the neck is a narrowing, we use the word cervical for narrowing. So the spinal nerves given off by the spinal cord in the neck are known as cervical spinal nerves. We count them in pairs. The first pair up there is C1 and the last pair is C8, because the spinal cord gives off 8 pairs of spinal nerves. When the spinal cord is passing through the thoracic region, it gives off 12 pairs from T1 to T12, and through the lumbar region, or the lumbar portion of the spinal cord, gives off 5 pairs, that is L1 to L5. The sacral segment of the spinal cord gives us 5 pairs, that is S1 up to S5. And the lowermost segment of the spinal cord, which is the coccygeal segment, gives us 1 pair. We call it CO for coccygeal 1. So you're going to find that the brachial plexus is made up of spinal nerves in the cervical region and 1 from the thoracic region, as we shall see. So when we look at this illustration, I want you to look at it carefully. You're going to see that this is the vertebral column. On the inside of it runs the spinal cord. These are cervical spinal nerves. And I said that the spinal cord gives off 8 pairs of spinal nerves in the neck region, both on the right and on the left. But here we are showing you only one side. So this is cervical spinal nerve 5. It means that above it there is C4, C3, C2, and C1. We begin from C1, C2, C3, C4, then C5, C6, C7, and C8. Now, why are we only showing C5, C6, C7, C8? The answer is that because C4, C3, C2, and C1 do not contribute to the brachial plexus, but they exist. So this image is showing us only the cervical spinal nerves which contribute to the brachial plexus. And what is happening on the right is the same situation that is happening on the left. We are just giving you one side of the body. So what spinal nerves form the brachial plexus? What spinal nerves form the brachial plexus? The spinal nerves which form the brachial plexus are C5, C6, C7, C8, and then T1. C5, C6, C7, C8, and then T1. These are the spinal nerves which give rise to this brachial plexus, both on the right and on the left, under normal circumstances. So under normal circumstances, the spinal nerves which form the brachial plexus are from C5 to T1. And I want you to note this. There are some instances where there is a variation. There are some instances where there is a variation. How? Sometimes the brachial plexus begins from C6, C7, C8, T1, and T2. We call that post-fixed. When the brachial plexus begins from C6 and not C5 and ends at T2, we call that post-fixed. Sometimes it may begin at C4 and end at C8. We call that prefixed. So the brachial plexus can be prefixed, whereby it begins from C4, C5, C6, C7, and ends at C8. That is prefixed. And sometimes it can be postfixed, whereby it begins from C6, C7, C8, T1, and T2. That's what we call the prefixing. And so what did I say is meant by the brachial plexus being prefixed? Who can answer? I've talked about the brachial plexus being prefixed and postfixed.
You said when the spinal nerves, when the brachial nerve plexus originates from C4 to C8, that's when it becomes prefixed.
Mm-hmm. And then postfixed?
It's when it originates from C6 to T2.
Correct. Very good. But the normal circumstances, when it begins from C5 to T1. And that is what we are teaching. But at the back of your mind, know that those variations, prefixation and postfixation of the brachial plexus, exist. Now let us go back to this brachial plexus. These spinal nerves, C5, C6, C7, C8, and T1, are the ones we call roots. So whenever they are talking about the roots of the brachial plexus, they are referring to C5, C6, C7, C8, and T1. You see, when these spinal nerves exit the vertebral canal from the spinal cord, they give off two branches. There is a branch which goes posterior, that's known as a dorsal ramus, and there is a branch which comes anterior, that's known as a ventral ramus. Rami are branches. So when it comes out, it gives off a small branch which goes posterior. That is what we call a dorsal ramus. And then the big branch comes anterior. That is what we call the ventral ramus. So spinal nerve has two branches when it comes out. The one which goes posterior to supply the posterior aspect, that's the dorsal. And the ones which come anterior are what we call the ventral rami. So the roots of the brachial plexus, C5, C6, C7, C8, and T1, we are specifically talking about the ventral rami, the anterior branches of the spinal nerves, not the dorsal rami. So these spinal nerves, which give rise to the brachial plexus, we call them roots of the brachial plexus. The roots of the brachial plexus are made up of the ventral rami of spinal nerves C5 to T1. Hope you are following. Now I want you to see this structure which we have colored red. The structure we have colored red is a blood vessel. This is a blood vessel, but it is mixed with the brachial plexus on its course. That is why we have to put it in context so that you know that it exists. When this blood vessel is below the clavicle, we call it subclavian. And when it enters the armpit, which is the axilla, we call it the axillary. So this is the axillary, then it becomes a subclavian, and you're going to look at its anatomy. So these spinal nerves are the ones we call the roots of the brachial plexus. Now, let's proceed. From the roots, where do we go? We go to the trunks. From the roots, we go to the trunks. How are the trunks formed? Spinal nerve C5 joins with spinal nerve C6 to form what we call the superior trunk or upper trunk. Spinal nerve C5 joins with spinal nerve C6 to form what we call the superior trunk. Then spinal nerve C7 continues. When it comes below the superior trunk, we call it now the middle trunk. It becomes the middle trunk. The part of the spinal nerve C7 which comes and reaches the region of the superior trunk, it changes name and we no longer call it a spinal nerve, we call it a middle trunk. Then spinal nerve C8 joins with the spinal nerve T1 to form the inferior trunk. The inferior trunk is the one which is now deep to this artery, but it's there. So these roots will then form the trunks. We have seen how the superior trunk, middle trunk, and inferior trunks are formed. From the trunks, we go to what we call divisions. We go to what we call division. Each of these trunks gives off an anterior division and a posterior division. An anterior division and a posterior division. And that is what we are seeing here. That the superior trunk is giving off an anterior division and a posterior division. The middle trunk is doing the same, anterior division, posterior division. And the inferior trunk is doing the same. It's giving off this anterior division and a posterior which is deep there, hidden by the clavicle and the subclavian artery. So these are the divisions. So in other words, we have 3 anterior divisions from each of the trunks and 3 posterior divisions from each of the trunks. Then from the divisions, we go to the cords. How are cords formed? The anterior division of the superior trunk and anterior division of the middle trunk are going to join to form the lateral cord. Why do we call this cord lateral cord? It is because it is lateral to the artery, which is the axillary artery. Then all the 3 posterior divisions, the posterior division of the superior trunk, the posterior division of the middle trunk, and the posterior division of the inferior trunk, all the 3 posterior divisions will join posterior to this artery to form the posterior cord. And the anterior division of the inferior trunk will come and form the medial cord. So these divisions will then form the cords. And then the brachial plexus will end there. So the brachial plexus is a network of nerves at the root of the neck and in the armpit, from where we get the different nerves which supply the muscles of the upper limb. It is made up of roots, which are the ventral rami of spinal nerve C5 to T1, trunks, divisions, and cords. The roots and the trunks are at the base of the neck. This is what we call the base of the neck. The divisions lie posterior to the clavicle. And then the cords are the ones we find in the axilla, which is the armpit. Let us see a simplified illustration as we continue to study the brachial plexus. This is a simplified illustration, and when you go to your textbooks known as SNEL, you will see it. C5 to T1 are the roots. C5 joins C6 to form the superior or upper trunk. C7 continues as the middle trunk without joining with any other root. C8 and T1 will join to form the lower trunk. These are the roots, these are the trunks. They are in the root of the neck. Then posterior to the clavicle, we are going to have the divisions. The upper trunk or superior trunk dividing into an anterior and posterior division, middle trunk, an anterior and posterior division, lower trunk, an anterior and posterior division. So these are the divisions which are deep to the clavicle. And from the divisions, we are going to go to the cords. The anterior division of the upper trunk and the anterior divisions of the middle trunk are going to join to form the lateral cord. This cord is known as the lateral cord because it is lateral to the axillary artery. Then all the three posterior divisions, posterior division of the upper trunk, posterior division of the middle trunk, posterior division of the lower trunk, all the three posterior divisions are going to join to form the posterior cord. And the anterior division of the lower trunk is going to continue in the axilla and it's going to form the medial cord. These cords are named depending on their relationship with the axillary artery. This is posterior to the axillary artery, and if the axillary artery is there, we will not be seeing it because it lies posterior. This is medial to the axillary artery, and this is lateral to the axillary artery, and the axilla is the armpit. Those are the parts both on the right and on the left. Now, what are we seeing? We are seeing that at the different positions of parts of the brachial plexus, we see nerves originating. Here we see nerves branching off from the roots. Here we see nerves from the upper trunk. In the area of divisions, we don't have nerves branching off. And then from the cords, we see very many nerves branching off from the cords. All these nerves which are branching off, each one has a name, and they are going to supply a particular muscle of the upper limb. And that's why when we begin looking at the muscles of the upper limb, we are going to talk about a muscle so and so is supplied by a nerve so and so, which is coming from this part of the brachial plexus. Let us look at some of these nerves. This nerve, which is originating from the roots, is known as the long thoracic nerve, originating from C5, C6, and C7. It's known as the long thoracic nerve. And we are going to see that this nerve supplies a muscle of the pectoral region known as the serratus anterior. There is another nerve here. Very important. This nerve is known as the dorsoscapular nerve. It is a branch from the C5 root. We are going to see that this nerve known as the dorsoscapular nerve is going to supply muscles known as rhomboid major and rhomboid minor and levator scapulae, the muscles of the scapular region. Then there is the muscle known as nerve to subclavius, branching off from the superior trunk. This nerve is going to supply a muscle which we shall see known as subclavius. Then there is a nerve here known as the suprascapular nerve. It's also branching off from the upper trunk. And this nerve known as the suprascapular nerve is going to supply muscles known as supraspinatus and infraspinatus, and so on and so forth. Lateral pectoral nerve. This nerve is originating from the lateral cord and it's going to supply a muscle known as pectoralis major. Thoracodorsal nerve, branching from the posterior cord, is going to supply a muscle known as latissimus dorsi. These two nerves, known as the upper and lower subscapular nerves, are going to supply a muscle known as the subscapularis. And we are going to be looking at those muscles. This nerve, known as the radial nerve, of course, the posterior cord finally divides into the axillary nerve and the radial nerve. This radial nerve is going to supply most of the extensors of the upper limb. And the axillary nerve is going to supply that muscle known as deltoid and teres minor. So we are going to be looking at those muscles and talking about their nerve supply. But at the back of your mind, remember one thing, that nerve we shall be talking about comes from one of the parts of the brachial plexus, and you come back and see where it comes from, and then you appreciate it. Now let us begin looking at the muscles. But today we are only going to look at the muscle of the pectoral region. Remember, the pectoral region is the region of the breast. So whenever you see pectoral region, you're talking about the region of the breast. Now, the largest muscle in the pectoral region is known as pectoralis major. Pectoralis major. When we are talking about the muscle pectoralis major, this is the muscle we are talking about, pectoralis major. When you remove the breast is sitting on this muscle known as pectoralis major. Now, this is how we are going to handle a muscle. When you look at a muscle, you must talk about its origin. Then you talk about its insertion. Then you talk about its nerve supply. And then you talk about its action. You talk about the origin of the muscle, the insertion of the muscle, the nerve supply of the muscle, and the action of the muscle. The origin of the muscle is where it bases from to perform an action. And the bony component where the muscle originates from doesn't move. It is the bony component where the muscle is inserted that moves. For example, look at this muscle pectoralis major. This is its origin. This is the origin of pectoralis major. And this is the insertion of pectoralis major. So when this muscle contracts, we expect this bone to move. This bone is known as the clavicle. So we are seeing some of the fibers of pectoralis major originating from the clavicle. And this is the sternum. So we are seeing some of the fibers originating from the sternum. So this muscle has two origins. The medial third of the clavicle and the sternum. The medial third of the clavicle and the sternum. Some textbooks call these fibers originating from the medial third of the clavicle, they call it the clavicular head. And then they call these fibers which originate from the sternum, they call them the sternohead. Because this muscle originates from the medial third of the clavicle and the sternum. And then the fibers will go and insert on the humerus. This point of the humerus where the fibers insert is known as the lateral lip of the bicipital groove. That is why it is very important for you to study the anatomy of the bones, because when I talk about the lateral lip of the bicipital groove, you must have studied the humerus and you know where it is. So you say that this muscle originates from the medial third of the clavicle and the sternum and inserts on the lateral lip of the bicipital groove. Pectoralis major. What is its nerve supply? This muscle known as pectoralis major is supplied by two nerves. The first nerve is known as the medial pectoral nerve, and then the other nerve is known as the lateral pectoral nerve. Those are the two nerves which supply this muscle, because you know that nerves stimulate the muscle to contract. So which nerves stimulate this muscle to contract so that it can perform its function? The medial pectoral nerve and the lateral pectoral nerve. Do we have these nerves coming from the brachial plexus? Yes. You go back and look at the brachial plexus. You see, the lateral pectoral nerve is a branch of the lateral cord, and the medial pectoral nerve is a branch of the medial cord. Those are the two nerves which supply pectoralis major. So we have talked about the origin of pectoralis major, the clavicle and the sternum, the insertion, the lateral lip of the bicipital groove, and then the nerve supply, the medial and lateral pectoral nerve. What about the action? What about the action? This muscle, when it contracts, it adducts the humerus. You know what adduction is? When they contract, they bring back the humerus to the body. So it adducts the humerus. Then it medially rotates. To medially rotate is to turn your radius towards the, to medially rotate it means that you turn your humerus round towards the body. Medial rotation. So it adducts the humerus and medially rotates the humerus. But the fibers which are originating from the clavicle also can flex the arm at the shoulder joint. So this muscle adducts the humerus, medially rotates the humerus, and these fibers originating from the clavicle can perform flexion at the shoulder joint. So you see, you talk about the origin, the insertion, the nerve supply, and the action. And when you go to the nerve supply, you must go to the brachial plexus to see which part of the brachial plexus does that nerve come from. That is one of the muscles from the pectoral region, the largest one, known as the pectoralis major. When you remove this pectoralis major muscle, deep to it there is another muscle known as pectoralis minor. Pectoralis minor. This muscle. We have removed our pectoralis major. You see, it was originating from the clavicle and the sternum, and it was inserting the bicipital groove. So when you remove the pectoralis major muscle, deep to it you have a smaller muscle, fan-shaped triangular muscle known as the pectoralis minor. It's also a muscle of the pectoral region. What is the origin of pectoralis minor muscle? Rib number 3, rib number 4, and rib number 5. Where does it insert? It inserts on the coracoid process of the scapula. That is why it is very important for you to study that bone known as the scapula in detail, so that when they talk about the coracoid process, you understand. It originates from the 3rd, the 4th, and the 5th ribs and inserts on the coracoid process. So it is this part which moves where the insertion is. When this muscle contracts, it depresses the shoulder. It contracts towards its origin, meaning that it pulls the shoulder down. So it depresses the shoulder. The origin, the insertion, the action is to depress the shoulder, and the nerve supply is the medial pectoral nerve, which is a branch of the medial cord of the brachial plexus. And you go back and you see it. This muscle is known as pectoralis minor, one of the muscles of the pectoral region. The third muscle is what we call the subclavius. This is this muscle, subclavius. Sub means below. Clavius means the clavicle. So below the clavicle, there is a muscle known as the subclavius. This subclavius muscle originates from the costal cartilage of rib number 1. This is rib number 1. And inserts on the inferior surface of the clavicle. It originates from the costal cartilage of rib number 1 and inserts on the inferior surface of the clavicle at the subclavius tubercle. There is an elevation below the clavicle known as the subclavius tubercle where this muscle inserts. So when this muscle contracts, it also participates in depression of the shoulder with the minor. And this muscle is known as subclavius. Origin, insertion. Remember the nerve to subclavius, we talked about that nerve from the superior trunk. This is the nerve to subclavius. It's the nerve which supplies this muscle known as subclavius. It's also a muscle of the pectoral region. So we have seen pectoralis major, pectoralis minor, subclavius, and then the fourth muscle of the pectoral region is the serratus anterior. Now this muscle is complex. Serratus anterior. This is the muscle. Serratus comes from the word to be serrated. When you look at its anterior margins, it is having a serrated margin. This is what we call a serrated margin. Because this is its origin, The origin is visualized on the anterior aspect, but the muscle goes and inserts posteriorly at the scapula. So it originates anteriorly from rib number 2 up to rib number 8 in a serrated manner. That's why they call it serratus anterior. Then it goes and curves and goes posteriorly and inserts on what we call the medial border of the scapula. That's why here we don't have a 3D. We do not see the fibers go posterior and insert on the medial border of the scapula. That is why you need to know what is the medial border of the scapula. This muscle is known as serratus anterior. It is supplied by the long thoracic nerve. That was the nerve which was originating from the roots C8, C7, and C6. This is the long thoracic nerve. It goes to supply serratus anterior. When serratus anterior contracts, it pulls the scapula towards the origin, which is on the anterior aspect. So it pulls the scapula so that the scapula is firmly held onto your back. It pulls the scapula so that the scapula is firmly held onto your back. You see this muscle? It is serratus anterior from rib 2 up to rib number 8. That is the origin. Then it goes posteriorly and inserts on the medial border of the scapula. So it pulls towards the origin, and when it pulls towards the origin, the scapula is held firmly at the back. Here we are looking at its C lateral view, serratus anterior. It's also a muscle of the pectoral region. Let's visualize it from above. This muscle is the serratus anterior. Now let's look at it from above. You see, it is coming from the ribs. It goes posterior and inserts in the medial border of the scapula. It is supplied by the long thoracic nerve, which comes from roots C8, C6, and C7. And when this muscle contracts, it pulls the medial border of the scapula, it pulls it towards the origin, which is on the ribs. So the force of movement is like that. So when it pulls towards the origin, the scapula gets firmly attached to the back. Serratus anterior. It means that when this muscle paralyzes, how does paralysis occur? When the nerve is injured, the long thoracic nerve, if it is injured, it means that it can no longer supply the serratus anterior. It means that the serratus anterior can no longer contract. So you're going to see the medial border of the scapula peeling off from the back because this muscle can no longer contract to bring it back. So this is indication of the paralysis of the serratus anterior, causing a condition known as scapular winging. It's like a wing of a bird because the scapula, when it peels off from the back, it's like a wing of the bird. So scapular winging is as a result of paralysis of serratus anterior, such that it can no longer pull the scapula back to the back. And what causes the paralysis of serratus anterior? Injury to its nerve supply, which is the long thoracic nerve, and therefore you cause a condition known as winging of the scapula. You tell a patient to touch, if this is the affected side, you tell the patient to use this limb to touch the opposite shoulder. When they touch the opposite shoulder and the scapula peels off, it means that this is the winging of the scapula. Serratus anterior is paralyzed due to injury of the long thoracic nerve. Because this scapula, even if this person touches the opposite shoulder, it must remain intact to the back. The same applies to P major, P minor, subclavius. When there's the nerves supplying those muscles, when the nerves supplying those muscles are injured, the actions they perform are not going to be possible. And that is how we can conclude that surely this person has an injury to this nerve and paralysis of this muscle. So today I've talked about the brachial plexus and I've talked about the muscles of the pectoral region. And the pectoral region is part of the upper limb because we saw that the muscles perform actions of the upper limb. The next time we meet, we are going to talk about the muscles of the scapular region. Which muscles are attached to the scapula? What are they? What are their origins? What are their actions? What are their nerve supply?